weight stigma in healthcare. The unfair treatment of people, of individuals based on their body size and weight. It has a number of consequences for those individuals. It leads to discrimination, stereotypes, harmful behaviours, and it affects all aspects of life. It's very widespread in our society. We find weight stigma in policy, in healthcare, in education, across the media and workplaces. There is very much this common misconception that each individual can control our weight by just merely eating less and moving more. Weight stigma has a huge impact on health. Contrary to the notion that you are shaming somebody into changing their behaviour, weight stigma actually results in emotional, psychological and physical effects on individuals in larger bodies. We really see this in healthcare settings. It's very common, it's very prevalent, and there's a growing body of research which illustrates this. I myself work with many clients who are in larger bodies, and they are commonly telling me about their experiences. It often puts people off actually seeking medical advice, going to doctors, etc., getting the support and the treatment that they need. So it is very serious. One of the things that I try to help them with is to be able to navigate this. The research finds that actually, instead of it being stigmatizing somebody because of their weight in healthcare being effective, it's more likely to lead to increased stress levels, increased calorie consumption, binge eating and eating disorders. Really, despite the good intentions of our medical practitioners, and we know that most of them do an incredible job of helping people, of supporting people, there is a great deal that is overlooked when it comes to weight stigma. It's not usually intentional. I'm going to talk a little bit more about what we can do about it. Now, somebody in the Food Freedom Collective Facebook community actually asked me what she could do about a certain situation. Recently seen a specialist about something nothing to do with her weight or body size, condition that was absolutely unrelated. The focus interaction was very much weight driven. She really felt like she wasn't listened to, and she wasn't perhaps treated the same way that somebody would be had they come in with the same condition but had been in a smaller body. She actually said, what can I do? How can I be prepared with certain responses to have to deal with weight stigma in the future, in future medical appointments, which she had to undertake? Many of us do with this support, I believe, and it's something that you have struggled with, then please do take note. So how can you protect yourself? So first of all, it's important to know that when we seek medical treatment advice, whether it's privately or via the NHS, we are the customer. And like as with any other service that we seek, that we use, we expect fair and equal treatment, and essentially we're the customer and we have the right to that. So I think it's important to first of all bear in mind that we are still the customer here. It's important to bear in mind that everybody has the right to ethical, evidence-based treatment, healthcare treatment, entitled to the same as everyone else. You are entitled to and have the right to speak out, ask questions, challenge. If something doesn't feel right, you can seek a second opinion, and you have the right to be listened to and be heard, essentially. Because I think many people fear the idea of challenging something that somebody who they believe is in authority and an expert, that they can't challenge if it doesn't feel right. But at the end of the day, you are an expert of your own body. So if something doesn't feel right, you're not happy with what's being recommended, suggested, treatment options, etc., please do speak out. And I appreciate that this is harder than sounds. But I think one of the things that can be really helpful is to have some prepared responses written down on a card so that you feel like, okay, I know what I can say in these situations. I'm going to give you some ideas now of some of the things that you can actually be prepared with, and obviously use your discretion as to which responses might be appropriate during that interaction. So you might want to say, I do not wish to be weighed unless it is medically necessary. And that could be for many reasons, such as for correct dosage of medication, for example. You can also say, if you need my weight because it is medically necessary, please explain why so I'm able to give my informed consent. Also, you can ask to please not tell me in that situation my weight unless I request it. I know for many people who's struggling with disordered eating disorders, just that whole discussion around what their weight actually is could be quite triggering. So if that's something for you, you have the right to say that. The other thing you can say is that I pursue healthy habits regardless of my weight status. Because you're a certain body size does not mean that you are not pursuing healthful habits. The thing you can say is, when you focus on my weight, it increases my stress levels and has the potential to relapse into disordered eating behaviours, and that's if it's applicable to you, or it might lead to weight cycling, and none of these things are helpful to me. The other thing you can ask, if for example you're being offered treatment that is very weight focused, when you believe that this is completely unrelated to what you're actually seeking help for, is you can say, do people in smaller bodies suffer from this condition? If so, what advice and treatment would you give them? You can also ask if you have any research you can share with me on this method of weight loss that you're suggesting, that it worked for the majority of people in the long term. So that's between 3 and 5 years. If somebody is suggesting certain weight loss methods to you. You could also say, if the focus has been around your weight in the conversation, I would like to focus on X, whatever it is, in the limited time that we have in this appointment. And you can also say, if discussion goes in the right way, I would be happy to share some research with you on weight stigma if you'd like to find out more about it. And I do have a number of links that I will share with you. Depending on where you're watching this video, you can find them around this video somewhere.